Good evening, everyone, and welcome to the 2066th uninterrupted webinar series of the International Forum for Promoting Homeopathy. I'm Arya. I'm a third-year student from Ashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. And today, our guest is Dr. SHASHI Mohan Sharma. He is the founder and director of the director and principal of Hahnemanian College of Homeopathy at UK. And with over 52 years of clinical experience, he's here to talk to us about a very important part of the homeopathic literature, which is from aphorism 83 to 104 of our organon, the soul of the meticuloustic, artistic, and scientific process of uncovering the totality of symptoms, which leads us to the individualized remedy, which is none other than case taking. And Dr. Sharma would be here talking to us about the art of case taking. So, if you would unmute.
Great. Sir is about to join the session.
Okay.
So,
Meanwhile, Dr. Arya, you can share your opinion or what you have learned from case taking. We are very interesting to hear from you. You are a young talented person. So it's quite natural. Yes, we have the awareness. Yes, please.
I guess it's case taking is one of the unique homeopathic case taking. I guess is one of the unique methods when compared to the other systems, especially when it comes to the mind. Then we all considering the totality. We take the mind, thermals, then all the generals. We consider it, and as I said before,
our guest has joined.
yeah.
Okay.
So should I introduce again?
It is okay. Can you see me now?
Yes, sir. Yes, sir. Sir, introduction is already over, sir. Ms. Arya has introduced yourself. You can begin the session, sir.
Thank you. Hello, good evening, India. I am from UK. Dr. Arya, can you hear me?
Yes, I can hear you, sir. Would you please share your PPT or open the presentation so that we could see?
There is some technical problem, but I can see you. So the importance of case taking is very important, because the whole treatment is based on the case taking. If you don't take the case properly, you can't find the right remedy. For this, you have to be very honest and take time in recording the symptoms of the patient. You give time to the patient to tell and don't interrupt him or her, because maybe there are so many thoughts coming. If you interrupt or interfere, then they will forget what they are going to tell you. Regarding case taking, the best procedure is to take and make the notes of everything patient is telling you from A to Z. So while case taking, there should be no noise, nobody around. You and the patient, or maybe a relative or somebody supporting the patient. When you take the case taking, you write down everything, leaving some space between two lines, because you can add it later or you can ask if something is remaining. We have to go for the main symptom and then concomitant symptoms. The main symptoms are very important and the mind symptoms must be given priority. So let the patient tell everything what he want to tell you. So then you ask, don't interrupt. If you want to ask anything, you make a short note and then ask it again. Case taking is very important, and art of case taking is very, very special. You have to be very honest with the patient and let the patient tell. If he is deviating from the subject, then you can put him on the line. Otherwise, let him speak. Sometimes people are telling stories. Don't listen to the stories, just ask them what is the main problem. Just like in my case, I always give time to the patient to finish up. When they finish the whole case, then we ask them. Never interrupt them, never put words in the mouth. Just like a lot of people are thinking Naxoinka is a medicine for constipation. There are hundreds of medicine for constipation, and the Naxomica is one of them. So never put words in the mouth of the patient, or you pressurize and take to the direction of the, remedy you are thinking in your mind. So in my 55-year practice, I have seen so many cases, maybe thousands and thousands, and a lot of them don't tell, and they don't know the value of the thirst, sleep, thinking, moods, behavior, aggravations, and relations. Then, in case of case taking, you have to be very clear what the patient wants to discuss with you and make a note of everything and then find out the remedy. The remedy can be one or two, but let's see which remedy is covering the most. Because sometimes we go, this afternoon a case came and it was a burning in the souls. So it is in the lachesis as well and in the sulfur pulsatilla. But what is the temperature? How much somebody feels, which whether he likes hot or cold, it depends on that. So Lexis, you will be surprised. Lexis is the remedy which is covering, but concomitant symptoms are there. I asked the lady, "You like loose clothing or tight clothing?" She said, "I don't like tight clothing. I like loose clothing." And what about her mentality? She said, "I get angry quickly." So I gave her Lexis. This is a very important to find out the remedy matching with the patient. Otherwise, no good of giving medicine unnecessary. Case checking is from head to toe, from mind to generals. Don't go from the generals to the mind to generals is the more important. General symptoms are there which are no good. Just like I have got this, I have got that. You have to be very particular, individualistic approach. For case taking, if you want a right remedy, you have to be very honest and you have to find out what the patient is telling you. Suppose in case of repertory, there are hundreds of remedy for each rubric, but you have to find out the right similmum. For that, you have to have a right approach for asking questions. Just like in Pasatilla, there is one symptom I confirm. They always want their head raised by pillow, two pillows, and they want open air, fresh air. So this is a pulsatilla. If there is a remedy pulsatilla, I confirm again. Do you like warm room or you want fresh air and cold air and open air? And they said yes. And the pulsatilla is the remedy, and it never gives me any failure. It is your respect attached to the homeopathy and practice. If you are giving medicine, it is your respect at stake. People come with a very much confidence and believing that you are going to help somebody. If you don't help them, then is the name of the homeopathy goes into bad name. So case checking is a very special process where you have to go through each and every minor symptoms. When somebody is saying I've got a pain in the arm, doesn't mean right arm, left arm. You have to be very precise. You have to see the aggravation and aggravation and concomitant symptoms. Numbness is there, not how they feel, what happens when they. Is somebody want to ask some question? Hello?
No, sir. So please continue, sir. There was some technical problem, sir. Please continue.
Pardon, what is happening?
Nothing wrong, sir. Your presentation is excellent. You can go ahead, sir.
What I am saying, when the patient comes, look at their face, look at their clothing. If somebody is very neat and clean clothing, very clear, it may be confirmation for arsenicum album. They are very neatly dressed, and some people are very dirty and the clothes are not very good. You can't say immediately sulfur, but you can go for sulfur as well in your listing. My practice since 55 years, each patient is giving me some information different. Each time I see a patient, I keep my mind open. Never think of remedy when patient is telling you something. Just like there was a lady which had the pain in the knee, better by walking. So better by walking is also in the Rostoxen, also in the lycopodium, surprisingly. So you have to go in the detail of each and every symptom, reconfirm it. If you don't confirm it, then your remedy will be wrong. The selection of remedy is very difficult in allopathy, very easy. In homeopathy, is very difficult. Finding a symptom is the solution. Then you find a remedy. You will be. I will just show you something from the repertory which is in front of me. Very special case I had, and that was a very 1 minute here. 1 minute. I tell you practically. And don't go for the disease. A lady came to me and telling me this symptom, that symptom, but I don't worry. We go with the disease. I have is numbness of the foot. There are hundreds of medicines. Argentum nitricum, arsenic album, conium, coccus cacti, graphitis, lyconux, phosphorescent, phosphoric acid. If you go for the precise information, left side is right side, in daytime, evening, night, and then aggravation, amelioration. As the lady told me, I've got a mostly numbness in my feet in the evening. So definitely there is a remedy for evening is calcarea carb. And calcarea carb is not first grade. It is second grade in the repertory. But you can see the fair, fat and flabby complexion is very fair and she is a heavy lady. So calcarea carb. Sometimes you see what you eat in the food, and you will be surprised to know they like eggs, especially both are linked. So homeopathy is a very special science. If you don't know how to take a case, then you fail in the treatment of the patient. Every time somebody is telling you something, you listen to them carefully. This afternoon, there was a patient I saw. It was a male, and he was telling me something. So I'm going to open that chapter. He had atrophy of the testis. After the X-ray done, chemotherapy done. So the atrophy of the testis is kali iodide, capsicum, gelsemium, carboanimelis, lysine. Surprisingly, the case was of the gelsemium. If I prescribe gelsemium for the atrophy of the testis, people think it is a mind remedy. No, it's not a mind remedy. It is a remedy for the whole person. Mind is a part of the body or a faculty of the body, not a whole thing. Some doctors only prescribing on the mental symptom. There is one doctor in India called Dr. Sehgal. He is always prescribing on the mind symptoms. But I take a whole case. Mind is a part of the case taking. So if you find the right remedy, it will take some, it won't help in 1 week, 2 weeks. It will atrophy of the testis and gelsemium, which is coming into the reproduction. It won't work in 1 week or 1 day. It will take at least 6 months or more. Similarly, cough at night and when falling asleep is meteorinum. And inspiration aggravate, lying aggravate, sulfur is the main remedy. Similarly, repertory is one of the best tool we have. If you have got a coffee in the night and your midnight before or until morning. Naxomika is a remedy. First great remedy. I am very happy that Dr. Kant did a very good thing for us. They gave it and pain in the back remedy. And that is the first effort they has done for us. And weakness of the back. Very important symptom is manual labor from natrum is the main remedy. Repertory is an open guide for us. You can see repertory every case. Pain in the limb, in the boring, just like pain in the ankle going up. The ankle is the lower part of the leg. So it can go down, but when pain is shooting up, his remedy is Linum Pal. From knee, pain can go up and down, not from the ankle. After ankle, there is a foot direction. But from the knee, you can find out pain is going up or down on the right side or left side. Pain is on the right, then on left, then on right. There are so many remedies like this which confirms everything. I am surprised how much effort they have done regarding this lysanthric there are hundreds of the medicine. Is the main remedy. And then laughing urgent is the main remedy. Overheated from bromium is the main remedy. There are so many things in homeopathy which don't, have in other science. Irritation of the larynx, sleep during laxis is the main remedy. Phosphorus and spongia is there, but if the upper part is spongia, we should know the whole body properly, including anatomy. So if you don't know the anatomy, then you can't do the justice with the case taking. Case taking is very, very important. And people don't know the value of sweet, sour, cold, warm, lemonade, drinks. So you go in the detail and ask everything. Don't do the quick case taking. Take the time and give them choice so that if they're not sure what to do, then you can guide them. They are always eating very fast. So whenever fast or slow, most of the parts of the abdomen, left hypochondria, left iliac point, where is they don't know the value of this particularization. Without particularization, you can't find the remedy. The best thing is give them the chance. If the pain burning, what type of burning it is? Just a minute, I show you one more case. Nausea is a very important thing. Nausea. There was a case of nausea. He was always saying when it happens, when I eat any fruit, and ipecac is the main remedy to main remedies. But from his own body, sulfur is a first grade remedy when odor. At the same time, ice cream after nausea is pulsatile is the main remedy. And he is called retching, he want to vomit, but he can't vomit, then Lakshmika is the main remedy. Surprisingly, we are very master of proper case taking. Homeopathy doctors are very special. 1 minute, please, that's it. Hello. Listen in. I was talking about one young girl. Her mother is very worried, and she was asking me, "Hi, but somebody is here now." So you can hear. Have a seat. This is कोई बात नहीं आप बैठिए so we can go again next week. I can get because there is somebody here and I told them half 4 is half 4 in the UK. In India is 9 o'clock. So in her case I selected the remedy, and the remedy is treating the symptoms which we have. We don't care what is the diagnosis. Diagnosis only helps to find out prognosis or certain symptoms. Sometimes we are giving medicine on the diagnosis, but diagnosis is nothing. We have to see what is in the diagnosis, what are the symptoms which have to be included in the case taking. So I think for today, it is enough. And next time I will be more ready for case taking. Is that possible? Dr. Dinesh?
Yeah, sure, sir. No doubt of that. You can present.
Next time I will give you the detail of case taking. I will make special presentation for you next time.
Okay, thank you, sir. Don't worry. Okay.
Thank you. Sorry. I will find out what is wrong with the computers, and next time we will do that from the computer. Is easy.
Okay.
Okay. Thank you, everyone.
As you all know, the case taking is very important in homeopathy. Not only in homeopathy, whatever be the system, case taking is important. And most of the case taking part is dedicated from practice of medicine, that is from Hutchinson methods. We used to take all the whatever be the case taking. All the case taking are similar, but the thing is that homeopathy has some more addition to that, and particularly the personalized medicine. As we know that we have to find the person in particular, whether he take hot or chilly, whether the patient is hot or chilly, or whether he is a cold-blooded or hot-blooded, or whether he is a semi-thermal person, like that. And in that respect, we will have to choose whether the patient is taking hot drinks or cold drinks, or even he takes both type of drinks. And not only it ends in that part, again it goes to the particular. That means whether he take a little bit of water or at large quantity of water. This is the basic difference between the other system of case taking in a particular point. They need not to go into that much of thing in that way, but we will have to we will have to identify the person in particular. That's the reason why we are going in that depth. Not and the mind also is very important. How the patient is speaking and how important his way of talking. Sometimes we can see that when a patient enters into the clinic and after sitting in front of you, he may a little bit fumbled and he may not be able to speak what he is supposed to speak in front of us because of the fear and because of the fright. Because he may forget to speak what he was supposed to speak. And if the bystander is there, then the bystander may say, "Oh, doctor, he's a fright, so he may not be able to talk to you right now." And so actually, whenever patient comes, they may come up with a lot of bundles of previous records and process records, as well as blood reports, scan report, and everything. But as a homeopath, we can ask them to hold these things in the table, or you can put them in the table. Before that, we will have to move forward. And only if a person talk from his mind, then only we can find what is the reason behind his illness. And the finding the reason behind the illness is more important than the disease itself. That is a very important fact. in homeopathy. As we know that when a patient come to you with a cancer or something else, that or even acute appendicitis, then the symptoms shows in front of you is more important than what is written in the paper. Of course, for example, appendix is the right side organ and the pain is in the right side. But usually it may not be right. Sometimes the patient may feel pain in the left side also. And so we may not be able to differentiate, but we would have to go to the physical examination, find, oh, it is on the right side itself. When we just press on the right inguinal region and that in between the point from umbilicus to that of part of the umbilicus, then you can find and there is a projection inside, or sometimes there you can feel a little bit of uh, 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 the thing in that particular area, and patient may cry as soon as you touch there. So that will give the indication that the pain right side and aggravated by touch or motion, that's quite common to the patient. So we will have to find what is the basic difference, what is the specific to the patient. That is more important than the common symptoms of the disease. So we used to say that homeopathy is mathematics, and why we say homeopathy is mathematics, because after taking a lot of symptoms, you may get hundreds of symptoms from a patient, and you write down the case history in a big way. But after taking the case taking, what a pure homeopath, the real homeopath has to do is, you will have to remove the symptoms common to the patients. Number one. Number two is remove the totality of the symptoms of the disease. Then you can find some rare peculiar symptoms in the case record. And then you take those symptoms and find and give the weightage, and then you can go for repertory with that symptoms alone. Then you get a remedy, and then you have to verify that remedy with the medicine, with the textbook, to confirm that this is the specific medicine for that particular patient. So if you choose in that way, definitely the patient will get the result from that medicine, and that medicine will work. This is how a homeopath need to move forward to choose the right medicine, and this is this shows the importance of knowing the person as well as knowing the disease. Then only you will be able to eliminate those symptoms common to the patients. We all know that even in appendicitis, that symptoms are common to whether it happened to me or somebody else, or somebody some other children also. The symptoms are quite common, but there may be some basic difference in between. That difference need to be checked. That is personalized part. That's what I would like to add to the session. And I'm inviting some of you to participate in this session. You can ask some questions also. We can go ahead with the discussion in that way. If anybody, I'm inviting Dr. Vibhu Prasad Panda sir. Sir is the principal of a Homeopathic Medical College. Yes, sir. You can add something more to that, sir. Anybody has a question, we can ask. Then, if nobody is responding, then I'm here to talk. And while case taking in acute diseases, it's very important. It's entirely different from chronic disease symptom. But then an efficient doctor can find the symptoms of a patient in acute disease in the shortest possible time, as you know. For example, a child is coming with the mother, and once you start examining the child started crying. Most of the child used to cry, but not all. But the crying is entirely different. The child try to hold the mother like anything, clinging. This is what we used to say, clinging, and then crying. Then in those cases, the medicine will be and shall be ceremonial. But when you start looking at a child entering into the clinic and sitting the mother, the child is about to cry when you start questioning. That's a typical pulsatilla. And when a child enters into the clinic and started playing with your stethoscope, taking away his stethoscope, dancing like anything, and going here and there, and asking doctor what it is, and then you say, "Oh, it is a stethoscope." Doctor, what is for this stethoscope? Oh, yes, for examine your chest and heart. Well, then what you mean by that, doctor? By chest? So that much of question he would be asking one by one, shouting questions up to the doctors, out to the bystander, what it is, what it is. That is the inquisitivity of the person to know what is there. So that's what he is telling. He is asking. So that's what tuberculum child or as well as carcination child is doing. So the inquisitive nature that itself will be an indicator towards this particular tuberculina. And as you know that in phosphorus, usually the child started touching, "Oh, doctor, you look smart, doctor. Oh, this is your new cloth. It's a very nice one, doctor. You look smart in that." And he used to touch on your pocket and say, "Oh, it's very nice, doctor. Very color. Your blue color you looks pretty, doctor." Then he start asking about, "Doctor, what about your wife? Uh, whether she is uh, quite well now. Last time you told to my mother that she is having some problem, but oh, that means that particular child is becoming more closer and closer towards you, and she or he used to talk about." That is the nature of service. That is the intimacy towards a person. Showing this. This is my doctor. This is my child. This is my parent. This is my friend. Like that. There's so much of attachment. That is the specific nature of phosphorus. And as you know, what about the chamomilla? When it can when it enters into the clinic, they start holding and crying, and they used to be crying in a big way. And when you ask the mother what is the version, doctor, she's having pain here and there, she's having a problem. But then you just look at the patient, you can find that sometimes the little it's coming on her lips and not on the cheek. You can see small teeth are coming in the gum of the patient, and it may look like red. And because of that, the child may be crying due to pain. In those conditions, we can apply chamomilla. Chamomilla, when after taking the child into the hands, then stop crying. Sometimes you will have to hold the child towards the chest for getting relief. That is quite common with the chamomilla cases. And so many, this is how one need to differentiate each and every patient. And for example, when you get a costigan patient, she or he will talk about something like that. Doctor, I was waiting. I was about to come, but I couldn't come due to some problem because my parents are not well. So I have to go there and buy this like that. That is his for while traveling, while coming over here. What I found that there was a grand person who fell on the side of the road, and I have to go along with him to the hospital. So that's why I came a little bit late. And what happened was that there was a person who came with a cycle and who hit on the man and he left away. So first I just tried to collect that person, to connect that person. I tried to bring that person. I couldn't collect contact him directly, but after some time I got his address and I just went there and I had to quarrel with him for that thing because he ignored the person after the injury. That means he is so much of sympathetic, not only sympathetic, but he is very much uh, specifically interested in a person who cannot do something for that. That's the nature of positivism. They cannot tolerate injustice that is coming out anywhere. That is also a very important fact. These are some of the clues to that will guide you to choose uh, symptoms inside the clinic within short time. This is actually what we used to listen or see in front of us. So you will have to utilize all your senses, five senses with the common sense also. That's the sixth sense that we used to say common sense. We used to say that homeopathy is a system which is stand upon the scientificity of homeopathy stand behind these art, art as well as scientific part as well as artistic part. Then what is the science of homeopathy? The science of homeopathy is that first it is just like a four-leg structure. Having the first leg is the knowledge of what we call as theories of homeopathy. That is knowledge of the science of homeopathy. That is the philosophical part. Then the second part is the knowledge of anatomy, physiology. That is the second part. And third is the knowledge of disease. That is and the fourth one is the application of the science for the purpose of cure that we call as the artistic part of homeopathy. So homeopathy has a scientific part as well as an artistic part. So we will have to apply all these things together to win the case. That is what I would like to add. And we all know that homeopathy is a system which gives specific importance to patient, to person, rather than simply a disease-oriented treatment. But the prescriptions can be of different type. We used to say so people used to say the classical prescription. That is what we mentioned here, a single remedy, single method. But in advanced pathological cases, we can have different type of prescription. You can go ahead with the constitutional treatment as well as some other pathological prescriptions along with that. In those conditions, we can use tinctures as well as biochemic medicine and random also. So this is what I would like to add to this session. If anybody want to talk, I'm inviting Dr. Matsuna Pandikar sir to say a few words on your experience in case taking. And sir, today there was a discussion going on case taking. Sir, how important you give to the case taking? Whether you prescribe in the shortest possible time or you take your own time to settle down with the patient. And please unmute, sir.
Kekao.
Yes, sir. Yes, sir.
Okay. Your section is English section.
Yes, sir. Yes, sir.
So, when for last 10 or 15 years, we are concentrated in treating chronic cases. Acute also there, but we are concentrated in deep-seated chronic cancer-like cases. We thoroughly take the cases in A to Z because the process of becoming or changing the constitution from childhood or from the birth onwards The rotomiasmatic influence is take origin. So A to Z we take case in detail in our 3 pages and 152 questions in our case taking form. But mainly we question about 40 to 50 or minimum 20 to 32 we get the miasm, the origin of the disease or mental changes and how it is lived, childhood how, adulthood how, birth history, and now with any mental stress, any torturing or any insult or any emotional stress or any family stress or financial stress or poverty stress. Each and everything is we take into consideration for selecting the medicine because very slight changes. Today's our subject is Tuja, study of Tuja. In Tuja, Medoranum, Bryonia, Pulsatilla, Staphysagria, all these are the medicines which can cause the history of its pathology from the suppression of stress and emotions. So each and every medicine has its own importance. So the slight changes in the taking of method of taking case or understanding the case will change the medicine and the result will end in failure. So the case tag is highly essential with all our previous details in and the living circumstances, emotional stress, emotional nature, cravings, modality, concomitants. All these are important. Without this, we can't cure a chronic cases. There is no effective protocol, sir. All for all our disease treatment like cancer or any diseases, even in rheumatism, modality and aggravation, amelioration, concomitants, radiating or shifting or migrating. All these are important. So when we become chronic and chronic, the doctor have to work hard for differentiate the material medical. Otherwise, it ends in failure. So this is the case taking and analyze the symptoms with the modalities, and all these are important. That's my suggestions and opinion. Okay.
That's very important. That we will have to look into the miasmatic aspect also that I didn't mention earlier, but that also is a very important factor. If you know the miasms in that way, you can differentiate the condition of the patient at the time of consultation, whether the patient is in acute stage, is in in a historic state, or or in syphilitic state,
Psychotic or syphilitic
psychotic,
or multimiasmatic
or even
or
a combination of
tubercular.
all. Yes, yes.
All these things are.
No, sir. That is very
So
differentiate
very
the
important.
miasm.
We have to look for the nails to hair.
Yes, but sir, we used to say that even a medicine has 3 phases: the soric phase, acute, this psychotic phase,
Syphilitic.
the syphilitic phase.
So certain medicine has got multiple miasms, but
Because
predominating miasm we have to study first of all. Then we can add the conjoined miasm in the cases of combined diseases. For example, in a syphilitic cases, a syphilitic miasm insisting cases of an adult or a children with a left-sided or right-sided or both-sided tonsillitis with a tonsillar abscess with the lymphadenitis in the left or right side. So the miasm is syphilitic. The thermal reaction is related with it. The concomitants are desire for warm things, desire for cold things, desire for hot things. All these are to consider with. We can add a mersol with it. If there is lymphadenitis, we can give a medicine which consists of mersol with iodine, merc iodide. If it is right-sided, it is flavum, and left side it is rubrum. Likewise, the miasm can be changed with the type of infection and inflammation or pathology. Likewise, in chronic diseases, we can study and use these medicines which we can apply the miasm likewise. Then the cure will be logical, theoretical, and fundamental. Okay.
Okay, sir. Thank you very much, sir, coming home. And I think it is a time to wind up the session. Ms. Arya, you can wind up the session.
Okay, sir, am I audible?
Yes, yes. You are not
Thank you.
visible now.
Thank you. Thank you, dear doctors, sharing such a session with us. Although we had only quite a time with Dr. Sharma, Dr. Danesh, sir was able to give us some insight into what case taking actually is and how important it is for homeopathy. Thanking all the doctors who have participated here. I am winding up this session. Thank you, everyone.